Hello and welcome. I am Dr. Anil Joshi. Welcomes you to my lecture series, Learn Radiology with Dr. Anil Joshi. Today's topic is on radio physics and that also simplified. It is mainly meant for the medical students, those who are going to take radiology as their career, that is the radiology residents and medical imaging technology students. It is very useful for them. This is a simplified version. We have also got this lecture available in extensive detail form on our website, also on our YouTube channel. Now to start with are the disclaimers. We acknowledge with thanks our college department from where we have got this educational material. This is going on since many years. We have also got in it certain downloads from net which are royalty free. We acknowledge, we thank all these people, and let's get going to the topic, radiographic cassettes. It's a conventional radiology now, slightly getting reduced in routine, but I feel in history it has got a good work done. So we should know about it, and we should know the technology, how it was, how best our earlier people has used it and got the correct information, correct imaging. So let's see the radiographic physics behind a cassette. So this is a cassette which looks very simple. It has got two openings. One is called the front, another is called back. Inside are the screens which are fixed, not like CR where the screens can be removed. This screen cannot be removed. The front screen, the back screen are totally different. They're not same. The radiographic cassette is a radiographic cassette is a square or a rectangular shaped metallic container used to hold a film, exposed or unexposed, and identify which is front, which is back, which are also mentioned on the film, and load the film. Film loading is same for double coating film, but in single coated film you must know about it, the back side and a front side of the cassette. Now what are the functions? One is to hold the screen at a perfect position and prevent it from damage, exclude all light from entering the cassette and fogging caused because of that, then maintain a close and uniform contact between the film and a screen, then exclude or protect it from the dust, the humidity, and many other water dropping or some other stains. It has to protect screens from that, and it has to protect cassettes, the film also, from all these things. Then it acts as a medium for exposure, and then it allows us to take out the film and use it by processing for our viewing and diagnosis. Now, what are the features of an ideal cassette? It should be lightweight to facilitate easy handling and carrying, but definitely the cassettes were of very lightweight because of the material used, mainly aluminum. Then easy to open and close under a low light condition. Often once you get used to it, you don't even need a safe light. You can just mechanically open the cassette, take out the film, put it to a hanger and put it to the developer. These all were mechanical things. No sharp edges or corners which might injure patient or the staff. Then strong and rigid to withstand physical damages from the daily wear and tear. The front of the cassette must be protected, or it must provide the beam. It should not cause beam attenuation. That's why it is thin than as compared to the back. Then internal rear surface must have an adequate layer of lead foils attached to minimize the risk of backscatter. Front allow as much as radiation. Back should block as much as, because it can cause otherwise a fog. Then cassette construction should ensure uniform contact between the film and the screen by use of a foam support. Now this needs to be checked, and this has got very important when we want to have a uniform quality of the film, and it should be available in the range what we want, or in the film size we want. It should be available, which is at most of the time is available. It consists of a front and a back hinge at the edge. Then thin sheet of lead foil attached to the back to protect the back scatter and to block the radiation going behind. The front, also referred to as a cassette wall, showing patient identification, then side marker, date, and many other information like hospital identification and all, that is with the radio opaque material, particularly of the lead. You are seeing a corner that is lead blocker. In that we write patient's identification and all that thing. You are seeing a lead foil on the back, then intensifying screen and the hinges. A range of locking methods are used like spring clip, slide locking to exclude light leakage. All these serves very well, and once you get used to it, they all are same. Then foam pads are provided to maintain close contact between film and screen. There are methods to check it. Your departmental people must know it, and I have covered it in some other lecture. That how you ensure that the foam is properly packing the film and there are no pockets between. All the intermaterial or plastic surfaces are given black coating to prevent internal light leakage. To ensure good film screen contact, gently cover cassettes back is used to minimize the photographic unsharpness because of the low contact. Now, material used in cassette construction. Nowadays, a low weight cassettes are designed. Synthetic materials are used. Earlier it was aluminum, but nowadays it is some other synthetic material. For minimizing beam attenuation, cassette front should conform to British standards, that is BS, what are the figure 4304/1968 form, which states that the material used should have an aluminum equivalent of less than 1.6 mm when 60 kVp are used, and if the plastic is used, it should be less than 0.2 mm at equivalent. What does it indicate is you cannot use a thick material. A thick material has lead is a thick, but we don't use them. That is only used behind to block the further radiation. The cassette constituency is by a material which is equivalent to the 1.6 mm of the aluminum. You cannot use thick material, otherwise film will not come good. Then cassette film is commonly used material is aluminum, then plastic, laminate or carbon fibers for following advantages: strength, lightweight, low beam attenuation. Then carbon fibers are used since these reduces patient dose due to low beam attenuation, particularly at low kV. Low kV has got less penetrating power, so the material should not be thick and absorb much of the radiation. Then it may be of metal or plastic lined with lead foils to protect it from the back scatter radiation from the bucket tray or otherwise. Then recommended back screen should have a lead equivalent of at least 0.2 mm when used with 150 kV equivalent. Now, cassette fittings, clips or the fasteners, usually stainless steel because they need of high strength, hinges, metal or the plastics, then pressure pads like plastic, foam, sponge, etc. Now, what are cassettes available? A single screen cassette having a single intensifying screen designed for a single side emulsion film. Then are the other applications like mammography, where we need a single screen because we do not want film to get unsharp. Small calcification should be clear, the sharpness of the image should be optimum, and double screen cassettes are used. They have got screen on both sides, used when double-sided emulsion films and used in general radiography where we can save the radiation because of the double-sided emulsion. Then care of the cassette should be treated gently. Contact with the fluid should be avoided. If stored on edge, it should be ensured that they are as nearly vertical as possible when you are keeping it. The number of cassette carrier at a time should be limited, should be carried securely between body and the arm with the fingers holding their bottom edge. These things practicals we have covered when we have covered a video series on radiography. With that, we are coming to end of the short presentation on cassettes. I thank you for giving me your valuable time. Please visit our website for comprehensive and detailed lectures on same topic and on many other topics. Thank you. Goodbye. Take care.